COVID cases yesterday. 774 of those cases are in Lagos alone. These numbers are going through the roof, Lagos. Second wave is not a joke, I'm telling you. We're going to talk more about it on today's Big Three. We all have to be careful. Out of yesterday's 1,204 cases, 654 were in Lagos. So I beg, take precautions. Take precautions, I beg. Limit your movement when you must go out, when you must go to work, when you must go to buy essentials. Wear a mask, keep your distance from people, wash your hands, sanitize your hands, because I need all 970,000 of you alive and well to listen to hard facts. Starting with today's Big Three, let's talk about NCDC's warning that COVID cases will soon overwhelm hospitals. Then let's talk about bandits collecting protection money in Niger State and residents of Bonny in River State protesting over pirate raids. And then let's talk about NIMC saying that if you got your NIN through your BVN, you still have to go and register. Remember, you can talk to us on Twitter at Nigeria Info FM. You can also talk to us on Facebook, Nigeria Info 99.3. On Committee You Report, Chukudi will be talking about something important in your various communities. And on today's Big Hard Fact, we're still celebrating Men's Week on Hard Facts. So we'll talk about the pressure on men to be financially successful and to provide financially. Because remember, like I said yesterday, we're spotlighting issues that are either unique to men or affect men more. Now, you get news updates on the hour every hour, and after the news at 6, I'll hand you over to Rufai for conversations with Rufai. But right now, let's bring you today's Big Three.
It's the Big Three.
The Big Three. On Hard Facts.
On 99.3 Nigeria Info.
How do we slow down the spread of COVID enough to let our hospitals handle it? How can the security architecture be strengthened in the short term? Is NIMC making NIN SIM integration harder than it needs to be? Those are the Big Three, Lagos. Let's talk. Our first story is a roundup of COVID-19 stories. We are reaching a critical level where our hospital capacity will no longer be able to cope with more serious COVID-19 cases, and health workers will be forced to make tough decisions. That's the warning from Chikwe Hekwazu. He's the head of the NCDC. He tweeted that yesterday. So basically, the second wave means that the number of new cases each day has spiked up. You know this because I've been updating you. Now, that means that the number of people who need to be hospitalized every day is going up. And because this time the symptoms are more severe, people are staying in hospitals for longer, meaning that it's taking longer for bed spaces to free up. So fewer free bed spaces and more new admissions. And that's why Hekwazo is sounding the alarm that very soon our hospitals may be overfull. But notice something in the last phrase, something he said. He said, health workers will be forced to make tough decisions. When hospital resources are not enough, health workers have to choose who is treated and who is turned back. Basically, they may have to choose who lives and who dies. And now some of you will say, Sandra, you're trying to scare us. Why are you people being alarmist? But I'm sure that many of you know somebody who before was saying, oh, this is all just scaremongering. Oh, it's all a conspiracy. Oh, there's too much discussion and too much coverage about it. But now that person has fallen sick. And they're not talking like that anymore. I'm sure you know someone like that. So please, better to be safe than sorry. The Lagos Ibadan Expressway Rail project is currently on hold because 60 workers tested positive for COVID-19. The Punch is reporting that figure. The Transport Minister himself, Rotimi Amechi, said that the launch of the line is paused due to the second wave. So we have to think about what this means for other ongoing projects in the country, both public and private. Now, if you talk about shutting down all projects, you're talking about serious damage to the economy. But is there a way to continue these projects while increasing the levels of precautions being taken and the level of surveillance of the people in those projects? You just heard during the news at 3, the PTF say to you that a shutdown will be dependent on whether Nigerians cooperate, Nigerians do the things that they're supposed to do. A lockdown, a second lockdown, will be dependent on whether Nigerians cooperate. You just heard that from the PTF coordinator. Meanwhile, Adamu Adamu, the education minister, said that schools may not open on January 18th if the COVID situation gets worse. So remember, the ministry gave that date a couple of weeks ago, but Adamu said yesterday that the date was merely a target and that they were reviewing it in case things get worse. And you also heard in the news that ASU is saying that it's probably not safe for universities to reopen. Strike or no strike, it's probably not safe for universities to reopen. They're saying this while non-academic staff are downing tools for 3 days. But yeah, those are the big COVID updates. What do you think of the Hekwazu's warning about hospitals being overwhelmed and health workers having to choose who doesn't get treated? How do you think we can slow down the spread of COVID so that hospitals can cope? What do you think about the fact that the railway project is being paused because workers at the railway tested positive for COVID? And what about the possibility of school getting postponed? What do you think about that? 0700 993 993 993 0700 993 993 993. Now, of course, you can tweet at us at Nigeria Info FM. You can share your thoughts via WhatsApp 080 959 75805. Remember, I always say New Year, new hard facts. So everybody gets 90 seconds, 1 minute, 30 seconds to make their point. We've got our first story down, two more stories coming. Let me hear from you. Hello.
Hello, good afternoon.
Good afternoon. What's your name?
Yeah, thank you. My name is Emmanuel.
Good to have you on the show, Emmanuel.
Thank you. COVID-19. I want to appeal to Nigerians to please don't allow yourselves to be pushed to death. COVID-19 is real. People are really going down with COVID-19. At the time we soon come, well, there will not be, enough spaces in the hospital again. Please don't go. Please. I'm appealing to Nigerians, so please boycott NIMC center. People are really going down with COVID-19. This number they are talking about is not for common man. It's because of themselves. They don't want the youth to take over in 2023. That is why. So please, they want to be monitoring as protesters and bad governance protesters. That is why. Please protect yourself. Thank you.
All right, Emmanuel. Thank you for calling us. 99.3. Sorry about that. Call back if you can. 99.3. Hello.
Hello. Good afternoon.
Good afternoon. Thanks for calling.
Yes.
What's your name, sir?
My name is Michael from Moe.
Michael, go ahead.
Yeah. I want to talk about this COVID-19 of 18.
Yes, please.
They are recovering much number these days. How are they doing it? Is it those people, the patients that are coming by themselves, or is government going out to test people to identify those that are having it?
People who are going to go and get tested, and those that government is also contact tracing, and then people who are also doing in private labs, all of that they're combining.
Okay. But I don't think they are ready to get it less, because with all this registration going on now, that people are going to converge in the mush, how are they going to combat this thing these days? And what I see is that it's like they've got it wrong from the beginning now. Because it is, I assume that it is now that the real sickness is coming. The real virus is coming. All those days that they just use their money for palliative or whatever they call, it wasn't here that time. It is now that this thing is coming, and they've used the money. How are they going to cope with this thing? So This is my contribution.
Thank you for calling, Michael, to contribute. 99.3.
Hello.
How are you? What's your name, sir?
I'm fine. Now that's my weather. They call Mr. Frank from Ojo Alaba.
Welcome, Mr. Frank.
Yes. You see, my own. I've been saying this thing in many places. This virus now is very, very real because it's global. It's not only here in Nigeria. So people should please listen. And as we they listen, we they help ourselves to avoid this lockdown again. And as we they help ourselves, make government help us. Not the only church they go lock down, no. Not the only schools they go lock down. They go follow lockdown NIMC, lockdown airports. Because if you check on September, October, November, early December, I don't know how high the thing be, but after this NIMC, the thing can't go high because and many of our brothers and sisters international are coming and going out. Please, let them control and help us. I don't want to experience another lockdown again. Please, that's my own.
All right, Frank. Thank you for calling to talk your own. 99.3, hello.
Hello.
How are you? What's your name?
Sandra. Happy New Year.
Happy New Year. Your radio is on. Can you turn it off?
Okay.
Who am I speaking with, please?
Mr. Darlington.
Ah, Mr. Darlington. Long time no hear.
In fact, I was preparing to do a case with
Your radio is still on. Oh,
I was preparing to do a case with you.
oh why?
Are you asking me?
Yes, now, why? What did I do to you?
When you don't pick up.
Do you know how many people that are calling me every day?
Okay, so we that started before all of them, we should not go and rest, Abi.
We don't know that you're calling now. There's no way to know whose number is what. We don't have your number saved.
It's okay, man. I understand. This thing is growing. Now, Sandra, please, there is something I want to ask. This panic about COVID-19. What has we done independently as a nation, as a country, to find out what is suitable for us? Do you know that we have been too lazy because we are waiting for vaccine from Western country? Are we not supposed to tax our scientists?
Good question. Remember, everybody gets 90 seconds. Mr. Darlington spent the first 33 seconds, fighting me. 99.3, hello.
Hello.
How are you? What's your name? Hello? Your radio is on. Can you turn it off? No, turn the radio off, not your, but okay. 99.3, hello.
Hello, good afternoon, Sandra.
Good afternoon. What's your name, sir?
Yeah, my name is Uyukomi Jacob. I'm calling from Golden State in Niger.
Welcome. Go ahead.
Yeah, my stake, about is on this school resumption. I don't know what our government is taking us for. Okay, like myself now, I'm working in private school. So how do they want me to survive with my family at this period of time? Why are they doing this now? Why can't they find a means to look for the solution about the coronavirus and look at how many people they are going to put on unemployment for now for their selfish interest?
Oh, sorry about that. But a lockdown isn't even selfish interest. A lockdown is really so that you do not get infected with a virus. Now, that's not to say that a lockdown is coming. But like I said, the coordinator of the PTF has said that a second lockdown is in your hands. If you want it to not happen, obey the restrictions like wearing a mask, keeping a distance, stop going to crowded places. If you do want a second lockdown, then don't obey the guidelines. That's what they're talking about. Now, of course, they've talked about things like schools reopening and they may have to postpone it. But that's also because the numbers are rising every day. I started today's show by telling you that 774 of the cases from yesterday were right here in Lagos. Right here in Lagos. Total for yesterday was 1,244 confirmed cases. So the numbers are through the roof. Like I told you last week, the first 5 days of January alone accounted for over 5,000 cases. And in November, for the whole month of November, we had less than 5,000 cases. So that less than 5,000 we had in the whole month of November, we had it in 5 days in January. So second wave is not playing with anyone. And so government is at a loss. Government doesn't exactly know how to deal with this. They honestly don't know how to deal with it. You've got Chikwe Kwazu saying that we're reaching a critical level where our hospital capacity will no longer be able to cope with more serious COVID-19 cases, and health workers may be forced to make tough decisions. And you pay attention to that last phrase, and you have to remember that it implies that when hospital resources are not enough, health workers have to choose who they will treat in the hospital and who they will turn back. It happened in other parts of the world. Doctors and nurses were having to choose who will live and who will die. I'm not being alarmist. I know that you're listening, you're saying, oh, Sandra, you're being alarmist. But I'm sure, like I said earlier on, you know somebody who before the person they talk say, oh, this is all just scaremongering, or this is all a conspiracy. There's too much discussion and coverage. They're conditioning your minds. Now that person has fallen sick. You know someone like that. So it's better to be safe than sorry. Now, I don't have the answers. Government obviously doesn't have the answers. And that's why one of the questions I'm asking today is what you think we can do. How do we slow down the spread of COVID-19 so that our hospitals can cope, so that we don't do a second lockdown, so that we don't continue to infect more and more people? Now, Adamu says they will review. He has not said that they will not open, but he said that they may not open on the 18th. He said yesterday that the date that initially was given was a tentative date. It wasn't definite. ASU is saying that it's probably not safe for universities to reopen, whether they're on strike or they're not on strike. Lagos-Ibadan Railway project is on hold because 60 workers tested positive for COVID-19. So there are a lot of tough decisions that have to be made. A lot of tough decisions all round. 0700-993-993-993. Everybody gets 90 seconds to say their piece. Hello.
Hello, good afternoon, Sandra.
Thanks for calling. What's your name?
My name is Jesus Stephen. I'm calling from Badagry.
Go ahead, Stephen.
I think God don't catch them. Now, listen to me, Sandra. COVID has been with us since January last year. And we now know the avenue that infection comes into the country. Why don't they shut down the airport? Now, why don't they shut down the NIMC center? Why is government not shutting down their own avenues of infecting the country, which is the highest? Why are they bothering about ordinary people going about their business? Have you gone to the bank? I was in bank yesterday. You know about area where the bank is more than Ushudi. Why is government not shutting down their own avenues? They are not shutting down their airport. They are not shutting down the NIM center. They are not shutting down their offices. They are not shutting down their looting centers. Why are they disturbing people? Are they interested in our life? Do they do road? We are dying in droves in road. Have they treated people? Do you know how much it costs to get a consultant card in a public hospital? Just to get a card in a government hospital in Nigeria. Have you been there before? But God don't catch them. Let them shut down the country and see the consequences.
All right. Thank you for calling me. We've got a message from Alawale who says, I met someone this afternoon who came to Lagos from Kaduna. She said anyone found without using face mask is arrested and made to pay 5,000 naira. And those hanging it around their chin are made to pay 3,000 naira. Our law enforcement must be empowered to do a similar thing in Lagos. The people in Lagos are just reckless. Olawale, thank you for your message. Is that the answer? Do you think that's the answer? And I do have to correct the impression that people have that it's people who are coming into the country that are bringing it into the country. Yes, they are part of the problem, but we in Nigeria are infecting ourselves now. So even if they shut the airport down now, we still have enough community transmission within the country for it to not make a difference if we don't pay attention to the guidelines that are supposed to protect us. More messages on WhatsApp. COVID is real, but most people are in my area at Itire, Ijesha, don't even take protective measures. I think there's a need for massive awareness, Taufik from Itire says. But that's the thing, we're talking about it all the time on Nigeria Info at least. I'm sure a lot of radio stations you tune into, they're also talking about it. So there is awareness. People know that COVID-19 is real, exists and that it's in Nigeria. It's the rest of it that is getting lost in translation, and I don't know why for the life of me. 99.3. Hello.
Hello.
How are you, sir? What's your name?
I'm Mr. Ejike calling from Yaba.
Welcome, Mr. Ejike. You've got 90 seconds.
Okay. My take on this issue is that I live to infectious disease hospital Yaba here. So I've taken bottled water to the hospital this afternoon. I'm a cycle rider.
Okay.
So when I saw the COVID test, you understand? They are not even social distancing themselves. That place is crowded. So and what I noticed within my you understand? In the evening, many people they go to all these chemists to malaria drugs to treat themselves. You understand? And when I was offloading the bottle at this mainland hospital here, I discovered that many all these big men cars that are coming in, they are coming. So what I understand is that the poor man, when poor man is sick, he or she will go to the nearest chemist and sort him or herself out. But big men, they will go to hospital. You understand? That's what I'm saying. And what I'm trying to say that the government is not doing it enough. If they want people to obey the law of the protocol, they have to provide like sanitizer. Because they know what they do. But people that survive like I am now, I'm a man of eight children. Me and my wife with 6 children. So if I don't go out, me and my family will not eat. So how do I cope? They lock me down. God will help us.
Thank you so much for calling us. I do have to say something though. He raised a point about people who are self-medicating, people who are buying medicine for themselves, thinking they're treating malaria. I would strongly advise against that. Do not self-medicate. Whether you think you have malaria or you think you have COVID, go to a doctor. Speak to a doctor. I have a friend who was diagnosed with COVID-19 and they gave him antibiotics, for treatment, and the antibiotics made him sicker and he had to and they had to withdraw the antibiotics. Zinc is a commonly prescribed drug. And it made him vomit very terribly for days because it was destroying his stomach walls. He only got better after they withdrew the zinc from him. So drugs that they administer very commonly to people who have COVID, they gave it to my friend and it made my friend very, 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 very sick. That's why if you have what you think is malaria or what you think is COVID, don't go to a chemist and start popping medicine. Speak to a doctor. Let a doctor take a look at you and let her be the one who says to you, okay, this is what you should do. This is what you should do. Don't go and kill yourself. I tell God, whether you be poor man or you be big man, speak to a doctor. Don't go to chemist. I know I'm talking to myself, but I hope I'm talking to one person at least. We'll take one more call and then we'll move to our second story. Hello, thanks for calling. Hello.
Hello, good afternoon.
Good afternoon. What's your name?
Yes, I'm Emmanuel.
Emmanuel, welcome. Go ahead.
Yes. We people in this Africa, we are disturbing ourselves. Say, these European Americans, and people in the Northern Hemisphere, like Finland, Russia, they are having this second wave because why? Because they have winter. They are in winter. We here in Africa, what is winter?
So why are you having second wave? So why are you having second wave?
We don't have second wave. It's just we are copying.
Goodbye. Thanks for calling. Our second story is the NIN SIM integration exercise. NIMC offices are open again. The strike is over, and of course the crowds are back. Yesterday I told you how the Ministry of Health is calling it a super spreader event. But I guess NIMC and the Ministry of Communications don't agree, because we have the Ministry of Health saying that they've written to NIMC several times and told them to call this thing off, to call off this registration process. But NIMC doesn't seem to be listening. Meanwhile, you know how some of you got your NIN automatically because you have a BVN. Yeah, some of you never went to NIMC office. You just dialed *346# with the phone number connected to your BVN, and they gave you an NIN, yes? Aha. NIMC is now saying that you people must still go to their office. Oh. They're saying that your registration is not complete, and so you won't be able to associate your other SIMs to your NIN. They tweeted this today. They said, quote, public notice. If your NIN was generated due to the BVN record harmonization with the National Identity Database, you will not have access to the NIMC mobile app, and your NIN SIM registration will be invalid. Kindly visit an enrollment center to complete your NIN registration, end quote. Now, I should note that some people are saying that this is not true because they've been able to use the app. So for those of you who got your NIN through your BVN, please, when you call, tell me whether the app is working for you or not. Tell me whether you've gotten a message from your telco telling you that your number has been linked successfully, because I don't understand what's going on. We will have to get NIMC back into the studio to explain what they mean by this information that they passed across today. But beyond that, there's an even bigger question here. Shouldn't this process be easier? Because on the level of tech, if the BVN database was used to update the National Identity Database, shouldn't those updated records be fully valid? And on the public health level, Nigerians are asking whether NIMC should be telling people who already have an NIN to still come to enrollment centers during a pandemic. Hopefully I get NIMC to sit down with me again so that I can ask them these questions directly. But right now, Lagos, let me talk to you. I'm asking you, do you think the NIN SIM integration deadline should be moved to reduce these crowds? A caller called me yesterday and she said to me, Sandra, fine, they announced since February last year. But before they gave this deadline, they saw that we had a deadline. They saw that we had a pandemic. They knew that people would get crowded. Why give a hard deadline? Why give a strict deadline? Why not allow it to be free-flowing? Why are they doing this? And it's a question I'm asking as well. What do you think about this announcement that NIMC made today about the BVN-derived NINs? 0700-993-993 993 0700 993 993. Hello, thanks for calling.
Sandra, good afternoon.
Good afternoon. What's your name?
My name is Olumuyiwa.
Good to have you on the show. Go ahead.
You call me at the right. You picked my call at the right time.
Okay.
When I went for my NIN number, they asked me for my BVN number, and when I gave my BVN number to them, they just type my BVN number on their system, and they bring the NIN number out, and they just give me with the card that this is your NIN number. So why is government now making another lacuna for Nigeria? Once you get BVN, you automatically get NIN. So why are they now saying until Kiniko coming to Kiniko office is not valid? And you want Nigeria to believe that a coffee in Nigeria. I don't understand the way the system is working. I said, let me repeat within my 90 seconds, that they just ask me for my BVN number, and they generate my NIN number for me through my BVN. So why are they making another problem for Nigeria? And you want them to believe that it's coffee in Nigeria? You see, the people that are ruling us, we are not fortunate with those we are calling our leader. We are not fortunate with people that are heading the top place in Nigeria. Good afternoon.
Good afternoon. 90 seconds on the dot. You got a love Olumuyiwa. Hello, thanks for calling.
Hello, Sandra.
Yes, what's your name, sir?
How you doing?
Welcome, go ahead.
This is Remy.
Okay, Remy, hi.
Yeah. it's very funny to hear NIN saying if you generate your number 3 billion, blah, 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 it's invalid. It's like there is more to this NIN stuff than what it should be. Because I don't think the reason why we should be converging at this moment when they are telling us on one hand to avoid crowds, to avoid gatherings rather, and on the other hand they are telling us to go out and register. It's like they're more focused on the money they're generating from the NIN than the NIN itself. The BVN contains all the information. I could recall the day you spoke with the representative of NIN. You gave us some information. So I was trying to
Oh no! Call back Remy if you can. Sorry about that. 99.3. Hello.
Hello, Sandra.
Good afternoon. What's your name?
Hi, this is my name.
Kaide, welcome. Go ahead.
Yeah, Sandra. Seriously, I don't think government has any moral right to tell any Nigerian to be careful if they are actually going to force people to be registering for NIN. And we have to take it seriously. We can't be blaming people for doubting COVID-19 if the government is making it seem as if it doesn't actually exist. Because government can't believe that COVID-19 exists and say, go out and go and stay in the crowd and go and register. It doesn't make any sense. It just does not make any sense. So we either have government, if this thing is real or not, they are the ones who should be asking. Thank you.
All right. Thank you for calling, Kayode. We appreciate it. 99.3. Hello.
Sandra.
Good to have you on the show again, Frank.
Yes. Did you remember when this BVN number was imposed? Did you know that this was exactly how it started?
I don't remember.
Now, people is using this through BVN now to get the NIN number. And the NIS members are saying that they must come to the center. That means they must come there to pay their 5,000, isn't it?
No,
Can
but
they help us? Wait, because why this thing is disturbing me is this. If we're talking of this COVID, it is not entering inside their ear. But we don't know how to stop this registration of 5,000 naira, and they don't seem to stop it, and government don't want to help us. My people are registered for Mosishom at Abadia 4,005. That means this thing is national. And their organs know about it, because I believe that as you then, Auntie Sandra, there's no how you do something in this Nigeria info now without the management to know. Management must know whatever you are doing there. That means whatever they are doing, their own management knows about it. That means they know about this money they are paying. That is why they say everybody must come to the center there. Let them be careful and rule us well. We are all human beings. Thank you.
Thank you. Said all of that in less than 90 seconds. 99.3. Hello.
My major issue with this NIMC thing is that I really don't understand what the urgency is about this NIMC thing. What exactly is the federal government chasing us for that is so urgent that has to be addressed before February?
Yeah.
I don't really see the purpose of this in the middle of a pandemic. This is just really putting people's lives at risk. And it's honestly extremely careless.
Yeah.
I don't see any reason behind it. There shouldn't be a deadline. What is the point? If you need people to register SIM cards, then you can wait. You can impose something on the NCC such that people will not be able to buy SIM cards without having the NIN. That can hold. But not that you have to impose it on all the people that everybody goes to go and register for NIN in the middle of a pandemic just so that they can keep their phone lines open. It doesn't make sense. It's putting people's lives at risk, and invariably it's going to lead to the death of many people. Thank you very much.
Thank you so much for calling. Appreciate it. 99.3.
Hello?
How are you? What's your name?
Samuel is my name.
Samuel, welcome. Go ahead.
Yes. What I really think is this thing, these people are not sick at all. The government does not value human beings. They value animals. So they are packing us together, packing everybody together to go and die. They don't value anybody. They should pack and go. Thank you.
All right, thank you. Emmanuel from Isolo on WhatsApp says, after all these years, Dr. Yakwazu is finally talking. Who is verifying the numbers? Please, COVID is not our problem. Is cancer not killing Nigerians more than COVID-19? Please, sir, give me a break. Emmanuel, cancer is killing people, but cancer is not infectious. It's not infectious. COVID-19, on the other hand, is infectious. That's the difference. Switch on your brain. We've got a comment here from Matthew from Shagamu. And Matthew says, Sandra, COVID is real. Now look at this scenario. The way people refuse to obey COVID protocol tells you the number of people that obey God's law. All right, Matthew, thanks for your message. Muiwa from Surulere says, my issue is with this NIMC app. There are too many conflicting stories. Today they say the app is from fraudsters. Tomorrow they claim to own the app. On top of this, the app is not even working. The rating is so low on the App Store. Why is government making life hell for us? This person is asking. School may not reopen because of spread of coronavirus, but NIN registration will still go on. They can't do anything for the masses without their own gain. Thank you for sending your message. But that's the funny thing. Like this NIN thing, you're not even supposed to pay for it. Now, I know that there are allegations, of course, from you who have called into the show that, perhaps the money that is being made in bribery is getting back to the top. But we've had people at the top tell us, if you catch somebody asking for a bribe, take their picture, take a video, and send it to the numbers that we've put out. We've had people be fired because of, because they were asking for bribes. So if they're doing that, is the money really getting back to them? Are they really taking kickbacks? Aurora from Ayoba says, Sandra, my president, how do you tell poor and hungry Nigerians who have been kept in that state by their politicians and government to be mindful of COVID while hustling for their daily bread? Trust me, that's the least in the mind of majority of those who are in the streets. The rich and politicians can take as much precautions as they want. But see now, rich woman or rich man get driver. Rich woman or rich man gets cleaner. Rich woman or rich man gets gate man. That gate man get one wife and 6 children. Those 6 children get friends. That wife, they go church meeting with other women. The cleaner, same thing. She they come from one family or he they come from one family. Gardener, same thing. But connected. No matter how you think you are or how you are, we are all meeting somewhere. There's something that connects us together. So it's not a rich man's disease. It's a disease that can affect any and everybody. Now, let me move you to our final story. Our third story on today's Big Three is 3 stories. 3 stories about insecurity. First, Niger State. The Guardian is reporting that in Shiroro Council, bandits are making communities pay 5 million naira a month not to attack and kidnap them. Yes, bandits are making communities pay them 5 million naira a month not to attack and kidnap them. They even listed the communities: Iburo, Gandu, Nasa, Piegbere, and Nasapa. There's also, hold on, let me see if I can pronounce this one correctly. This one's called Jazadidna, Gofan A and B, Chukuba, and Galapi. If you are from one of those communities or you have links to these communities, call me and confirm this story or deny this story. But yeah, according to The Guardian, the local bandits gave these communities a monthly bill. Pay this money, 5 million naira, or we attack. And they've been raising the money to pay. They levy citizens. They've also set up community farms to pay the money with the harvest. So that's Niger. Now let's move to River State, Bonny Island. You don't have bandits in Bonny Island. But in Bonny Island, you have pirates. Sea pirates. And the people of Bonny had a protest march yesterday demanding that government takes action. Apparently, the pirates have been attacking boats moving between Bonny and the mainland River State. They rob the passengers and then they make them jump into the sea. And this has been happening steady. And the only way to go to Bonny is by boat, is by water. You can't go by road. The only way to go to Bonny Island is by water. And then you go there or you live there and you want to go to the mainland Port Harcourt and you are attacked by sea pirates and you are robbed and you are made to jump into the sea. So that's River State. Now let's go to Abuja. In Abuja is where a kidnapper was kidnapped and made to pay 1.5 million naira ransom. True story. We heard it from the police spokesperson, Frank Mba himself. They had the kidnapper in custody. That's the kidnapped victim in this case. They caught him after he was released. So that's how kidnapping is rampant. That's how rampant kidnapping now is. That even the kidnappers are getting kidnapped. Oh my God. Now, I brought you these 3 stories from 3 different parts of the country to highlight the point being made by many Nigerians that the security architecture may be overwhelmed. Pirates are operating with impunity on the sea. Bandits are taxing villagers. Kidnappers are kidnapping kidnappers on the highway. So my question, Lagos, is how safe do you feel? How strong do you believe the security architecture is? What do you think needs to be done to strengthen it? You call me now and you say fire the service chiefs, but what exactly does that do? What exactly will that do? It goes beyond who the service chiefs are. Even if you change the service chiefs, the entire security force, will they suddenly sit up? Or will they suddenly have all the equipment and the training that they need? So I want deeper answers. What should be done? 0700 993 993 993 0700 993 993 993. Yes, you can still talk about COVID-19. How do we slow the spread of COVID enough to let our hospitals handle it? And how can NIMC make this thing better? It seems to me like NIMC is making integration harder than it needs to be. 0700 993 993 993. You can still talk to us on Twitter at Nigeria Info FM. WhatsApp is 080 959 75805. Hello, thanks for calling. Sorry about that. Call back if you can. 99.3.
Good afternoon.
Good afternoon. What's your name, sir?
It's Ogeretega.
Welcome. Go ahead.
Yes, talking of about your last story. It's very, very simple. If government really wants to tackle insecurity in this country, we need to start from the local governments. People are so close to each other from the grassroots. Now, you know what? Most people don't take their governor responsible for their insecurity in their respective states. It's because all of us in this country, we believe is the federal government, and it's true they are in the control of police and army and everything. But now, if you make each state have their control in their resources or their state affairs, insecurity will be reduced in this country because federal government right now they are very, very overwhelmed. A lot of problems on their table to solve. So how many will they able to solve? That's why we don't call on our respected governor in our respective states. What we do is, hey, government, federal government, fire service chief, fire service chief, fire this, fire police head, fire brutayo. No, if we keeping our this thing on the federal government, this problem will keep popping up. So we need to spread this power from federal government to states so that if there's a problem in a particular state, everyone can call on the governor of that state. What is happening in this our state?
Thank you for calling, Ogenetega. Quite the great answer there. Hello. Thanks for calling.
Hello.
How are you? What's your name?
This is Akinloye from Songosa.
Welcome. Go ahead.
Hello.
Yes, go ahead, sir. I'm hearing you.
You see, it is laughable the way the federal government is making the issue of insecurity to look like. See, I've been to I'm a zoologist and an environmentalist.
Okay.
So I've been to Yankari and to that same Niger State.
Okay.
So I carry out few research at in both states.
Okay.
And I don't know if you watch this wildlife on the DSTV and stuff. You see that even the smallest ants can be monitored. Why, when they were giving birth, were mating and some other things. So it is possible to monitor these people from their hideouts.
Okay.
Nigeria is having satellites. Look at what happened when the BBC monitored what happened at the Lekki too. See, this is not a rocket science. You can monitor where the bandits are coming from, when they leave their camp, when they carry out an attack, and even they fire it, and whichever one of them is causing insecurity. Government should not make these things look as if there's nothing they can do or they are handicapped, except there's something they are not telling us. Sincerely, we have brilliant people in this country who can bring up technology, who can help. But it seems that government didn't want to allow people to even come in to help. And I think the securities and architecture of Nigeria knows what is happening. It's like they are not coming out to tell us some things. See, it is possible to monitor them, whether they are kidnappers, whether they are bandits, whether they are terrorists. It is possible. Let the Nigeria security let them sit up. Let the security sit up. Let the president sit up. Let those who are governing this country sit up and do something about insecurity.
Thank you very much for calling Akinloye, the zoologist from Ogun State. 99.3, hello.
Hello, this is Raphael calling from Munshin.
Hi, Raphael, go ahead.
Yeah, I want to make my contribution based on the issue of the COVID-19.
Please go ahead.
I want to appeal to the citizenry, whether we trust government or not, whether we believe in them or not, whether we have anything to do with them or not. Let us abide by the rules of engagement. It will help us on the long run. The issue of we don't trust government, the issue of this and that, I don't think it should come into play. We shouldn't even be talking about this. Everyone is meant to comply. The thing is fighting. This second wave is not a joke. And we shouldn't feel that the governments are trying to take advantage of us. Whether we even feel that way, let us still protect ourselves. This is for everyone. For those who believe in what the government is saying, and to those who don't. Then, on the issue of the NIMC, I would really advise the government to put away this issue of the deadline, because it will make the government look contradictory. You are fixing it, and everyone is packing themselves in there. COVID-19 protocols are not being observed, and you end up defeating the purpose, of this issue of safety. So I'm appealing to the government to, put the issue of the deadlines of the SIM registration, NIN registration, and all that on hold for now. Then, so that we can address this issue of the second wave
of the pandemic,
of the COVID-19. Yes.
Thank you very much for calling. We've got Oshiodo Lawrence, who thinks, I think there's vaccine now. Why is government threatening to lock down? Yes, there's vaccine, but Nigeria doesn't have the vaccine yet. No African country has the vaccine just yet. We have prominent Nigerians going to places like Dubai, for instance, to go and get vaccinated. Nigeria probably cannot afford to get vaccines that will reach everybody. And they did say that they're going to get 100,000 vaccines, hopefully by the end of March. That's what they're saying. But even that 100,000 vaccines is only enough for 50,000 people, because you have to take the vaccine twice. You have to take two shots of the vaccine. So 50,000 people out of, on paper, 200 million people. It doesn't go anywhere, does it? That's why the PTF is telling you that it's in your hands. If you don't want a second lockdown, now your handy day. Wash your hands, wear your masks, don't go to crowded places, which I know it's rich, because they're also the ones who are telling you to go and get your NIN. And they're also the ones who are telling you if you have NIN from your BVN, you're still invalid, so you still need to go and update it. It does the head in. I'm not even front. Like, I wouldn't even front. Like, it makes my job hard. It makes my job very, very hard. And I just wish, like, Otta Emmanuel says, if you don't have NIN, you can't renew your passport. Okay. Alex Agbo says, someone went to NCDC head office in Abuja yesterday. There were no officials. As is usual of civil service in Nigeria, the people had to wait for them to resume. Even water to wash hands, their tap wasn't working. As for Boko Haram, when the government wants to fight them, we will know. All right. Modio Kende says, please, what is the importance of this NIN of a thing? What does it solve with the problem that we're facing in this country, that during pandemic, they're still forcing people to come and register? I need answers to this. Kayode Samuel is saying, seriously ashamed of the government playing with the life of Nigerians. There's less adequate information and education on the radio and television. Go along the road, there's nothing to tell people about COVID-19. Go to BRT terminal, nothing to show for COVID-19. Kazim Olabode on Facebook says, the government tells us COVID is real, and same government says you must go out and register for NIN, even when you can get it from your BVN, and they want us to believe them. We've got more people who are sending us messages here. Lakame Paul on Facebook as well says, good afternoon. I operate 3 different bank accounts, which has been linked with my BVN. I've tried the star 346 code, but it did not bring my NIN number. That means they've not automated it yet. So if you've dialed star 346 and you don't have NIN, you need to go and get an NIN. But now they're also telling us that even if you dial star 346 and you've never gone to a NIMC office before to get NIN and you have NIN, you still need to now come down to NIMC office. So let's go to WhatsApp. WhatsApp is 080-959-75825. 080-959-75825. Is the president of the country not aware of the congestion and crowd in the various NIMC offices? The directive to put the registration on hold should have come from him. This will make Nigerians to believe that COVID is real. The president is observing social distancing in Aso Rock where Nigerians are sent out to the street to get registered. Temitope sent us that message on WhatsApp. Sandra, my name is Luga Exclusive from NNPC filling station in Majek. It's a big shame that despite the amount of natural resources we have as a country, the government cannot secure the people. There's need for the government to end this banditry as soon as possible. Otherwise, it may be out of hand. Let them seek international assistance to ending the bandits. I think Nigerian government just doesn't want to take care of the security problem. The normal thing is securing and protecting life and property. Isaiah from Lekki says. Isaiah, thank you for your message. President Sandra, I lost my friend. He came back from work vomiting. Vomiting blood, unknown sickness. That's a message from Sunday in AJ City. Sunday, I'm terribly sorry to hear about the death of your friend. I'm really, really sorry to hear about the death of your friend. May his soul rest in peace. We've got a message from Ubong Johnson. The government just they talk. Just check out our BRT buses. It's a COVID-19 infection booth. Okay. We've got more people here. Good afternoon, Sandra. My name is Lawal from Badagry. I'm so disappointed in our leaders. Everybody knows that there'll be a second wave. What have they done to prepare to solve the problem of the second wave of the world? Of COVID. Okay, not the world. I don't know where I saw world from. Caesar said that those who say that they're going on strike because they were put in harm's way by the government, what exactly did the government tell them that made them safe all of a sudden? Or are they now wearing hazard suits at the registration center? Good question, my good man. Very good question. But well, there was a negotiation and they decided to go back to work. We've got Megida listening online from Benin City who says, Sandra, they try. Nigerian government? Okay. Let's see more people who are sending us messages on WhatsApp. We'll take this one. Nigerians, please, let's obey simple COVID-19 rules and regulations for our safety. Comrade Akban Silas in Magodo said. He says, may we not do the bidding of Bill Gates and co. Oh, my God. You're one of those? Are you really? You're one of those? Okay. Comrade Akban. Is this the same Comrade Akban that calls me? Because I would have thought he would know better, but here we are. 99.3, hello.
Good afternoon, President Sandra.
Good afternoon. Thanks for calling.
I want to comment on the NIMC issue.
Yes, please, go ahead.
We very, very clear the government is not serious. We know the importance of the NIN number, right? Probably they want to try to for them to be able to track down those bandits and Boko Haram, and so we know. But at this time, how can you do something at this time when you know there's a second wave of this coronavirus thing, and you still want people to go outside there and register themselves? As for me, I am not bothered. if they want to block my line, they should block it because I have nothing to lose. Though it's my line. I like my line so much, but I can't just go out there and risk my life for nothing. Because at the end of the day, they are the ones that will benefit from it. So if they like, they should block it too. But for me, I know they will not block it. It's just they want people to rush out and do. But for me, I am not going anywhere until everything is calm. Then I cannot go and do my, because that was what I did when the issue of BVN came up that time. I wasn't rushing myself. At the end of the day, I got my BVN back then. So they want to make this thing faster and faster. But at this time, that's the big question. At this time, why this time?
Cool question. Thank you for calling. That's the last call that we can take on today's Big Three. The Big Three comes your way every single day. If it's a Monday, we bring you the big weekend. On the big weekend, we take a look at the biggest stories from over the weekend. And if it's a regular weekday, we take a look at the biggest stories from that day. And that's what you just listened to. So we'll bring it your way again tomorrow, the biggest stories of tomorrow. But coming up right now, Chukwudi Ezugu will be having a conversation with someone in Ibeshe Titun community. I hope I pronounced that correctly. Ibeshe Titun community has a power problem. There's a terrible power supply in that community, and so Chukwudi will be talking to a resident in that particular community after the business news. And after that, let's talk about the pressure on men to succeed. Like I said, this week on Hard Facts is Men's Week. We're discussing men's issues so that you stop dragging me. So 5 o'clock, let's talk about the pressure on you as a man to succeed. Who puts that pressure on you to succeed? Why do they put that pressure on you to succeed? I'm Sandra Ezekwesili. Don't go away.
Back to back and back of the biggest talk.
It's just a general attitude to environmental laws. You know, mechanics, food sellers. One of the reasons why I believe
Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.